Hey guys, Dr. Andy here. Today I want to talk about how we develop neck and upper back pain when we are a desk worker, okay? So since the pandemic started, I can't tell you how many people have started to come in with upper back pain, neck pain, headaches, even some shoulder pain because of their jobs. You know, when we were still at the office space and we had these wonderful ergonomic setups, neck pain and upper back pain because of their job was still one of the top two reasons that we saw patients here in the office. And then once we moved home and we started trying to, work at our dining room table with our little laptop, our incidences of neck and upper back pain because of our job just skyrocketed. It's been one of the main things that we've been seeing here in the clinic, all right? So today I kind of want to cover the reasons as to why. And I'm sure you can probably put your finger right on it. And it has to do with the way that we're sitting at our desk and the way that we lean forward, okay? So I'm just going to try and give you a visual example of what you look like when you are working at your desk, right? So good positioning. If you're upright, you're sitting upright, your back is not against sitting back here, and you're not supposed to be leaning too far forward. You're supposed to be upright. And so if you're going to be upright, you got to sit forward a little bit on your chair. And your head is supposed to be up in neutral. Instead, what happens is our head starts to come forward and our shoulders roll. And so I bet if you look around, if you're at the workplace and you can look around at some of your coworkers, you're going to notice that their head and their shoulders are rolled forward like this. All right. And what this does is it puts a tremendous amount of strain on the neck and the mid back, specifically the muscles and the joints of that area, right? So your body is not designed to be sitting here like this all day. You're designed to be upright and you're designed to be moving. So two big problems. Problem number one is the lack of mobility, the lack of movement. Whenever we don't move a lot, if we maintain this stiff, kind of rigid position all day long, number one, we're gonna have a loss of blood flow because of the lack of movement. And that lack of blood flow increases our stiffness and it increases our pain even worse, okay? So that's number one. But number two, the actual physical bad posture, we call it anterior head carriage, where our head comes forward and our shoulders come forward like that. It's putting a tremendous amount of strain on the upper trapezius muscles, on the levator scap muscles, even the scalenes here in the front of the neck, all right? And I bet if you are a desk worker dealing with some neck pain, you think all your problems are back in through here in the back of the neck where you feel all that tension. You're gonna feel it at the base of the skull a lot too, but I bet if you start to squeeze in here in the front muscles of the neck, these are called your scalenes as well as your sternocleidomastoid muscle, SCM, you're gonna feel that it's really tight and it's really sore, and if you squeeze really, really hard, you're probably gonna notice that there's a lot of discomfort, right? It's not supposed to be there. You're not supposed to be this tight in front, and it has to do with that forward posture where we come forward like this, all right? So one of the biggest problems we see with our desk workers is that neck problem or that neck pain and that mid-back pain. It's all come from that anterior, shoulder positioning, that shoulders rolling forward, the anterior head carriage like this, where all of the muscles in the front get too tight and pull you, and then all of the muscles in the back actually start to loosen and they don't hold your good posture like this, all right? So we've been seeing a ton of neck and mid-back problem with our desk workers, and it's coming from this bad posture, and it's coming from that lack of mobility. So what can you do about it? Well, there's a couple of things you can do right now at your desk. If you're sitting at your desk, you can grab hold of that chair on one side, take your hand, put it on top of your head, and you can actually pull and angle it and change the angle a little bit, and you can do some stretching of those muscles, right? Lean it back and try and get those scalenes. You can grab the other side of the chair and do the same thing, right? You can start to move it around. You can bring your shoulders back, squeeze the shoulder blades together like you're trying to kiss the shoulder blades, right? And then hold it there, squeeze for 5 to 10 seconds, and then relax, right? And you're gonna wanna do this regularly. It's not good enough to just try to think, oh, I'll do it once and that'll fix all my problems. You actually should do this about once an hour, and it will make some big improvements. So we need to move more, right, to get rid of that rigidity, right? Pump up the blood a little bit better, so make sure you move some, squeeze, right? And then also just try and fix that posture where you're holding yourself upright a little bit better. And that will go a long way towards helping with that neck and upper back pain if you are a desk worker. All right. If you have any questions, always remember to send them my way, and always remember to live with passion and not pain.